What? Probably better filmed from here.
Upper left 5, I think. Oh, look at that. Dog goes when he's gonna sit.
Goes up to about 6.
That's Cusby Carabelli. It's a dog goes when you gonna.
Yeah, 4.
Can a caramel be on any tooth then?
It's the upper right 6
Can a
as well.
caramel be on any tooth?
Carabelli.
It's upper right 6.
Isn't it called like a, you've got beautiful
LA.
I thought you said it was
Upper
upper
right
right
6
six.
to do.
Isn't it called like a dent in dent?
So the tooth of the urn, upper right 6.
Oh, is that the one you want to have in drill?
Yeah.
Is that the one you want to do? If I do that, you can't see it.
Yeah, well, you could do that one then. You could do that one if you
The
want.
light's
No,
really
don't have
bright,
anything
yeah.
Nothing doing today.
Just,
Oh, so we're just doing this then?
yeah, just a demonstration.
Okay.
Yeah, I don't know.
Where she can. Now the trick is to feel with the end of the mirror handle for the fleshy part. Okay? And then press on it. You see the tissues blanch.
Yeah.
Is this recording sound as well, Krishna? Then slowly slide the needle, don't stay very still for you, along the mirror handle and into the palate.
Well done,
Well done,
Rob.
Rob.
Ever such a good boy.
Did you see it?
No.
Real man. Like a boss.
So if you put your needle right at it and then remove the handle, the mucosa comes up and penetrates the needle.
And what's that going to anaesthetise?
Palate.
Just around the 5.
That was nice.
Roughly. It's just the same as buccal infiltration. Give them a couple of teeth either side. But you'll see that the mirror handle will blanch the tissues.
Because there's some blocks you can do, isn't there? Greater palatine block.
You can do, but
You
don't
don't
get
need
into
to
that.
do it.
No, no. Anterior maxillary answers and all.
But so if you wanted to take that tooth out, would that be enough on the palate side?
I've not given them a lot.
No, but just that in
Yeah,
that place.
that would have done, yeah. Would have done. Okay? You feel a bit numb?
It's on here.
I only injected the tiniest amount.
So
Not really,
you press the mirror hand, you
What you do by
compress the
pressing,
tissues,
you're going to
Edit
press.
this video.
and then you release it, and then the mucosa meets the needle.
Yes. But the most important thing, by compressing the palatal mucosa, you are bombarding his spine.
That's what I mean, like distraction of
It's
the
not
nerve.
distraction, it's
It
called the
is.
gate theory.
So as I said, the
Because
gate
there's
theory,
so many neurons firing to tell them about
you
that
did.
pressure. There's no way
Yeah.
for the pain to get through,
Chocolate, mate.
so you don't feel it.
Yeah.
Right.
Oh,
buccal
right.
infiltration.
Oh, chocolate.
Yeah, quite a lot.
Told you it was a bad idea.
How critical.
Saving it for later.
Oh, God.
Now, sometimes it hurts when I do underneath the lip, so I'm not going to demonstrate underneath the lip. Okay? You know my phone? Right. If you put the cotton roll in and stretch it, and what happens? You stretch all the nerve endings away from each other.
What we're stretching, and you're stretching the.
Mucosa. Just open a touch, move up, that's it.
Numbing up the chest.
Feel anything through that tune?
Buccal left 5 again.
Because you stretch it so tight, that's why it's painless.
No, that's not the most pain. Did you feel
Is
it?
that okay?
No.
I need to stretch it.
Right. Why couldn't you feel it?
Because
Really,
you penetrate it so slowly that if you hit a pain nerve ending, it moves out of the way. So if you're going fast, you impale the nerve ending. I don't like using these thin needles because I think you can push the pain nerve endings apart far more effectively using a wide needle. Because it's wider, it's not as sharp, so it won't penetrate, but it will have pushed them out of the way as long as you inject very slowly. Now the bit you've been waiting for, Rob, and I
So
do
you're
what?
putting the tissue towards, aiming for the apex of the tooth.
No, no. Just go through the mucosa and start injecting. And once you've started injecting, you can then slowly advance your needle into the little spot of pool of local anaesthetic you created. And so you're advancing into an already numb area.
Yeah.
Do you subscribe to the whole angling the bevel towards the...
Doesn't really matter. The reason you do that,
Because some people say it's necessary, but...
yeah, it is. If you hit the periosteum, when you break a bone, the bone doesn't hurt. It's the rupture to your periosteum that hurts.
Yeah, okay.
Bone has no nerve endings, but periosteum is incredibly richly innervated with pain nerve endings. So avoid going underneath the periosteum.
Yeah.
Now, in the 1960s, they did some experiments, I've forgotten where, and what they did, They were numbing some dental students, so medical students for blood pressure, dental students for injection technique, and they deliberately inserted the needle underneath the periosteum and then did vitality tests. And it went incredibly numb very, very quickly. But when they started drilling the students' teeth, guess what? It hurt them. But they tested it with electric pulse testers and ethyl chloride and they couldn't feel anything. Anybody like to hazard the reason why? Because the cheek didn't go numb. So the student didn't think they were numb. So a lot of it is kidology. So if you give an injection super periosteum, it will soak through the periosteum and get the tooth in. It just takes a bit longer, that's all. But the cheek goes numb. The patient feels confident. And so they feel numb. And they don't feel it when you drill the teeth.
That's the thing going on.
Yeah. You alright?
Yeah.
Dying to pray.
Which tooth have you done today?
He's not.
He's not.
No, he's going to be numb all over if we do that. Right,
don't
okay,
mind.
Robert. Let's have a look. Let's just have a look. Right, okay. Now, if we want to come in and take a photograph of this, because we can show where the injection. Now, there are two ways of doing it. You can penetrate, give a quarter of a cc, and then remove, and just let that work. Or you can go in incredibly slowly, inject as you go, until you hit that lingula, and then just keep aspirating and injecting, aspirating and injecting. Which job would you do, Robert?
Do the first one.
Okay. Okay. Right. Just be turned down. That's good. Right. There we are. There's the ramus of the mandible. Gives us our aiming point. We can come across the other side of the mouth and just gently, very, very slowly penetrate the mucosa and very, very slowly give a little shot there. I'm actually slightly too lateral, but this will get it numb anyway. And withdraw. Did you feel that?
No, just a little tweak. That's it.
It's not a steal.
So we'll just leave
But
that
at
for
the
a couple of
same
minutes.
time, I know you're just doing it for demonstration purposes, but you didn't obviously administer, say, a full cartridge, which would normally do for an ID block. Isn't it the actual fluid going in that can cause the pain?
No.
Because it's cold, or you're doing it too
Rubbish,
fast?
that. Too fast.
Yeah,
That's the reason. But we're not going to inject too fast. We're
but
going to
I mean, if we're just inserting a needle painlessly, it's going to be painless.
So you inject very slowly when you go in next time. Just leave this for a minute or so. Work.
You know, you said
You're saying it's
inject
penis
tissue.
because it's not injected.
You said inject tissue. Like,
That's one of the
The
reasons.
needle
what
itself
are the
is
risks?
also
Yeah, but like one of the most like of it
Obviously,
for
we're taught to
patients.
go in and then aspirate.
Yeah.
It's not the actual needle going in, it's the
Yeah, so you-
administration
when you're
of
near,
the anaesthetic.
you
It's
stop,
the most
then
painful.
That's why you put that drop
So you
on.
don't
Yeah,
just inject all
it
the
doesn't matter. I like
That's fine.
it's like kind of the pressure exerted on the tissues once.
Yeah, I know what you're saying.
Tell you what's a bigger worry, rather than hitting a blood vessel, is they hit the actual ID nerve. So you'll be scraping
You
off
had
the chip
that, didn't you,
to see
Becky,
that.
when it shot down?
They say that you can get really close sometimes to the IE nerve and it will cause a discharge as well
Yeah,
because
it
of the
will.
metal.
Yeah.
But that doesn't necessarily. It's like literally you haven't hit it, but you're just really close to it. So because it's metal, it causes a discharge.
Surely the chance
and
of
so-
hitting the nerve is quite high.
Hit that nerve, you know. You do
So
cadaveric
what do you do to
dissection.
minimise? What do you do to minimise the risks of?
Very gentle.
the-
If you slide it along the inside of the mandible, you'll hit the lingula before you get to the nerve.
Oh, okay. So
What'll happen when they jump out the chair?
And scream.
So what do you
Feels
do
like
if you've got a
you're-
needle in the mouth? Take it out.
Yeah.
it'd probably be instinctive to just.
It is instantly numb, and the numbness will last for about 12 to 24 hours.
Right.
Yeah.
Yep.
Y'all having a good time?
Oh, I'm loving it. Feels.
Can you feel it working?
Yeah.
Why were you sliding the needle? Like, when you mean you slide the needle to avoid hitting
Slide
the
it
nerve?
along the inside of the ramus of the mandible, descending ramus.
Yeah, because you're taught to go in and then.
This is where the bevel does count,
Oh, okay.
because you keep the bevel towards the bone so it doesn't penetrate the periosteum. So on these syringes, there's your bevel mark. So we make sure that bit goes upwards. Right, Robert, let's finish your ID block. I'm not going to give you a full cartridge.
Okay.
As wide as you can for me again. Lovely. Raj,
Yep.
push your pin back. You okay with that? Mm-hmm. There we are. Aspirate and eject. Very, very slowly.
So you've touched the bone there and then come back.
Yeah.
1 mil to, what was it again?
1 millimetre.
Just make sure you're not injected into the periosteum.
Yeah. I've been thinking about this all morning, thinking, please, when I aspirate, don't get some blood. You're all right, we didn't.
Just for like the purpose of the video, not with the needle, but can you just point out the structures for us so
Yes,
we can see?
sure. Okay. There's the ascending ramus. There's the pterygomandibular raphe. And there's the site of the injection. Right in the apex of the V. Have you got that, Krishna?
Yeah. It's a bit dark, but just got it.
And if you do aspirate and there is blood, do you have to change the cartridge again?
No.
What happens if you aspirate and there's already blood in the cartridge? Will you not?
Well, you should, before you